Let me introduce Mrs. Laura Piccolo. Laura is 48 years old. She's been a patient of mine for 5.5 years and has also worked in my office for the past 4 years. And she has been on testosterone replacement for approximately 2 years. So why don't you tell us why you started on testosterone? What was wrong? Let's start with the strength and the energy part, the physical part.
Well, before I was taking testosterone, I was very tired. Wasn't sleeping at night. I had lack of energy. I just couldn't do anything around the house at all. Okay, and it was just a matter of me always constantly being tired, constantly yawning all the time, not having enough strength to do anything. You know, that was just the bottom line of what, how it was.
At that time, before you started, was there any problem with depression or anxiety or anything like that?
Yes, I had very bad depression. I always used to want to be alone. I never wanted to be around anyone. You know, I was never happy. You know, it affected my depression really bad. I had self-esteem issues.
Meaning what?
That, I didn't have, I felt like I wasn't, like really worth anything, and, I would take offense to whatever anyone said really fast. I would get very irritable. I would, like, snap as soon as someone said something to me. And it was really bad. I never really thought I would be like that, ever.
Yeah.
And I hated myself at that point.
What was happening with you sexually at that time?
Sexually, I didn't have a good sex life at that time at all.
What was the problem?
I was getting orgasms, but it wasn't orgasms where I could say I enjoyed it. Like, you could have an orgasm and say, wow, that was great. At that point I wasn't enjoying it. I would have an orgasm and then it would just, I would just fade. Everything would just fade, like I never had sex at all.
And you didn't have much in the way of desire?
No. My desire, and even like if he touched me, or like if we had foreplay or something,
yes,
it never drove me crazy. It never
Were you having any vaginal problems?
No, I was just very dry. Every time, we would try it, he would always have to get me wet in order for us to really do anything. And that would annoy me because, I would have like a slight urge to have sex, but then when I got dry down there, it just wasn't, it just wasn't pleasant.
And there was another issue with you. At that time you were having very bad menstrual cramps.
Yes, very bad. They were cramps where I would practically double over. That's how bad the pain was. I would get nauseous. I couldn't, all I wanted to do was just like lay down. I would have to take Midol or Pamprin and then just lay down until I was bloated a lot. I was having, like, the breasts were hurting.
For how many years had you been bothered with these types of menstrual cramps?
15 years at the most.
15 years.
Mm-hmm.
That was after your son was born.
Right.
And how long were you having these other problems? The depression, the sexual problems, the low self-esteem, the fatigue. How long had that been going on?
About 3 to 5 years, I would say.
3 to 5 years.
Yeah.
Was it getting worse, staying the same?
It was getting worse.
Getting worse. Okay, and then we did a testosterone blood level on you, a free
Right.
testosterone. We found that to be low, and we started replacement therapy, which was in, 22 months.
Right.
And what did the testosterone replacement do for you?
Oh, the testosterone changed my life a lot. Okay, in the fact that
Let's talk about the physical first, the strength and the energy.
It gave me energy I never had before. Okay, I was able to clean the house like I never did before. I could go walking as opposed to before I took the testosterone. I couldn't even walk 2 blocks. Now I can walk 4 or 5 blocks without getting tired or anything like that. It's really,
still that way today.
Oh yeah, definitely. I'm not sorry that I ever took this.
Yes.
Because it's.
And what about the mental effects of replacing the testosterone?
Mentally, I have a totally different attitude towards a lot of things.
Like what?
Like, as opposed to before, I didn't, like, if someone said, oh, she's not feeling well, and I would say, who cares? And like now, they could tell me, oh, she don't feel well, and I'll say, oh boy, I really feel bad, I would go and like see that person and say how you're feeling, things like that. As opposed to before, just couldn't give, I couldn't care less.
Has it affected your depression?
Yes, but I'm not as depressed. I have more ambition now to do a lot of things I didn't have ambition to do before.
And what about, you said you had a poor sense of self-worth before the testosterone. Did that change at all?
Yes.
In what way?
Well, now now I know that I'm worthy of a lot of people, especially my husband. I'm not, as opposed to before, I was like I had like a jealousy thing before, and now, I don't have that like I had before. It's changed my whole demeanor, and I've seen it. Because I know when my shot wears off, I know how I get.
You start to relapse.
Yeah, I start to feel like my attitude again
And
is
you know
changing.
you need the next shot.
I definitely know when I need the next shot.
And what did it do for you sexually?
Sexually, you have to, if you only know how my life has changed sexually since I had these shots. I can have an orgasm like that now.
They're satisfying?
Satisfying ain't the word for it. I'm telling you.
And the vaginal dryness?
Oh, that's a lot better. I get wet a lot more faster now. And it's a lot more enjoyable. I just couldn't enjoy it before.
Yeah.
It's totally different now. And the foreplay, like when he used to touch me before, used to touch my breasts and stuff, I used to go, don't, please, because I wasn't in the mood.
Right.
And now he can do it, and I'll just get, turned on fast,
Mm-hmm.
It wasn't like that before. And I've seen a difference sexually a lot in the way we have sex right now.
And what happened with the menstrual cramps?
The menstrual cramps, I have a lot less cramps now.
Is there a significant difference?
It's like 60% now.
Okay.
It's like 60% out of 100. I mean, I'm not saying I don't have cramps at all. I have the cramps, but it's cramps I could deal with. Before, I couldn't deal with the cramps. I used to actually cry from the cramps. That's how bad they were.
Okay, now, so this has been going, this is now 22 months down the road. So what have been the problems that you've experienced from replacing the testosterone? What kind of side effects have you had?
I've just had minimal hair growth. I haven't had any other side effects at all.
And how would you characterize the hair growth? Is it a
percentage?
Well, is it a problem?
No.
Very little.
It's very little.
Especially on the current dose when we found your right dose.
Because when you first started me, I was on 100 milligrams.
Right, now you're on...
Which I told you was overstimulating me.
Right. And now
I'm on 20.
Yes. And you're one of the girls who noticed that when we lowered the dose, it worked better.
Mm-hmm.
You had less hair growth,
right.
And it worked better.
This is the second shot I've taken on 20.
Yeah.
And I've noticed. I mean, it was good on 30. It's just that I was having more hair growth on 30 than I am now.
But it's still working just as well.
Yeah, the 20 is working just as good as the 30 was.
Yes. Now, your husband is also on testosterone replacement.
Yes.
And there's something you'd like to tell us about what you've noticed about him when he gets his shot versus when the shot is wearing off.
Right. When the shot is wearing off, he's stressed out, irritable, he's mean. Could be mean to no end. I'm telling you, he's like threatening. He'll like pick a fight with me out of nowhere for nothing. Okay? And I would tell him, it's time for your testosterone shot. And then he'll tell me, well, how would you know? And I'll say, just by the way you're acting, I know you're due for a shot.
And when he gets the shot,
what happens? He got this shot Tuesday. I'm telling you, he was a totally different person. His attitudes changed. He's the most loving person that you'd ever want to be with. When he was like, before the shot wore off, I didn't want to be around him. I couldn't be around him. Now, You could be around him and as opposed to sexually, he could never, he would get it, he would get an erection, and then right after we did it, it would die out. Now, he can get an erection 3 times that same night that we're having sex. And he's amazed at it too. Because he'll tell me, how did I come 3 times? And I'll say to him, it's the testosterone shots.
Is he having any side effects from the testosterone
No,
shots?
he's not
No.
feeling anything.
No.
No.
And he's been getting them for how long? About the same amount of time?
I think so.
A little less?
It might have even been after me.
Yeah, a little, I think
Yeah.
probably about 1.5 years.
Yeah, maybe around that.
Okay, well, that's very interesting. I'm certainly glad to hear all of this. And thank you very much.
Thank you.